Antimicrobial resistance. Antimicrobial resistance is one of the world's most important public health and development threats.
Before starting, do you know what are antimicrobials? Antimicrobials are the drugs used to prevent and treat the infections. Each drug works against only one type of organism. So how it works? It works by interfering with or blocking the specific target sites, such as cell walls, cell membranes, and ribosomes. This will inhibit the growth of the organism or killing them. Antibacterials, also known as antibiotics, is the drug used to against the bacteria, antivirals against viruses, antiparasitics against parasites, antifungus against the fungus. All drugs are categorized as antimicrobial. When organisms such as bacteria, viruses, fungi, and parasites develop resistance to the drug, this will cause the antimicrobial drug become ineffectiveness. This process is defined as antimicrobial resistance, or AMR. When AMR increases, treatment of infectious will be more difficult. Let me begin by explaining the mechanism of antimicrobial resistance. Basically, there are several mechanisms involved. Firstly, interference with cell wall synthesis is a common mechanism of action for antimicrobial agents, particularly antibiotics. Antibiotics like penicillins interfere with cell wall synthesis by inhibiting enzymes called penicillin-binding proteins, PBPs. Thus, bacteria can develop resistance to antibiotics that target cell wall synthesis through various mechanisms, such as the production of beta-lactamases that inactivate penicillins by hydrolyzing the beta-lactam ring present in beta-lactam antibiotics. Furthermore, bacteria can also use efflux pumps to push the antibiotics out, which reduce their effectiveness inside the cell. This mechanism basically are found in the outer layer of gram-negative bacteria. Thirdly, certain antibiotics operate by inhibiting the crucial process of protein synthesis within bacterial cells, such as ability to read genetic instructions and synthesize proteins accurately. However, some bacteria can develop resistance by acquired genes that encode proteins capable of binding to the ribosome and preventing the binding of antibiotics. These allowing the bacterium to continue protein synthesis despite the presence of the antibiotic. Lastly, antimicrobial agents such as sulfonamides that inhibit specific metabolic pathways in microorganisms will disrupt the essential biochemical processes necessary for the microorganism's survival. Bacteria can develop resistance to sulfonamides through mutations in the gene encoding DHPS. These mutations lead to alterations in the structure of DHPS, making the antimicrobial agent less effective in inhibiting the enzyme.
Now, let's discuss the factors that cause the rise of resistance. First, misuse and overuse of antibiotics. For countries that lack adequate diagnostic facilities, antibiotics are a frequently prescribed medicine to patients. Besides that, antibiotics can be bought as over-the-counter, OTC, drug without prescription, causing the spread of drug-resistant pathogens increases widely. Second, inappropriate prescribing patterns include unnecessary antibiotics or the selection of inappropriate antibiotics for the patient. Next, the wrong dose and the incorrect duration of antibiotics for the patient to take. Third, incomplete treatment courses. The patient fails to finish the prescribed antibiotic course, allows bacteria to survive and develop resistance. The medicine will be wasted too. Last but not least, agricultural use of antibiotics is the major contributor to human AMR. Antibiotics are used in livestock farming to increase the demand for animal protein. This will increase the AMR as animal-derived products such as meats, milk, and eggs contain the antibiotic residues.
The impact of antimicrobial resistance on healthcare includes increased costs in resistant organism infections, changes in antibiotic prescribing policy, increased infections and limited treatment options, and the risk of surgery and chemotherapy. The added costs in infections caused by resistant organisms compared to susceptible microbes involve additional expenses for diagnostic procedures and laboratory tests, and the added costs will directly affect the drug industry's marketability. Talk about changes in policy. When resistance surpasses a certain threshold at the population level, narrow-spectrum agents lose their effectiveness against common diseases. To address the escalating challenge of antibiotic resistance, scientists have periodically revised them over the decades. The rise in antibiotic resistance not only leads to more infections, but also limits treatment options. Epidemic clones of resistant bacteria contribute to nosocomial infections, adding to the disease burden. Because of prevalence of antibiotic-resistant pathogens, surgical procedures and immunosuppressive chemotherapy become less safe and effective. Now, let's talk about solution of antimicrobial resistance. What is antimicrobial stewardship? It's a coordinated program aimed at promoting the appropriate use of antimicrobials, including antibiotics. Antimicrobial stewardship not only improves patient outcomes but also plays a crucial role in reducing microbial resistance. Next, let's talk about surveillance and monitoring in the context of antimicrobial resistance. Antimicrobial surveillance is like keep watching how they change over time. By keeping track of these changes, we can spot emerging threats early on. This will help decision-makers step in and take action before things get worse. Now, let's dig into something cool called alternative therapies. Picture this: using not only new antibiotics but teaming them up with other therapies. These are like our superheroes in the fight against bacterial resistance. That will become another therapy that could address antimicrobial resistance.
Antimicrobial resistance has killed at least 1.27 million people in 2019 and nearly 569,000 in 2023 so far. An interesting but scary estimation by the UN states that by 2050 up to 10 million deaths could possibly occur thanks to superbugs and related forms of antimicrobial resistance. So let's put our thinking caps on. Why is AMR a global concern? Well, you see, AMR has the potential to affect people at any stage of life, but it doesn't stop there. Antimicrobial resistance can go as far as not only affecting the healthcare industry, but even the veterinary industry and the agricultural industry. With antibiotic resistance, many diseases such as organ transplant and cancer therapy will require second or third treatment, which may cause serious side effects such as failure of the organs. Now, what does the doctor prescribe to you when you fall ill? Antibiotics. If antibiotics or antifungal lose their effectiveness, or one becomes resistant to it, then we lose the ability to treat infections and control these public health threats. So how do we combat these challenges? Some ways include preventing infections, improving the use of antibiotics and antifungals, stopping the spread of resistance, etc. Let's explore these in some detail, shall we? Preventing infections. And how do you do that, you wonder? Well, Captain Obvious, here's a fun fact for you. Almost 80% of common infections are spread by hands. So what does that tell you? Wash your hands regularly, that's what. Using antibiotics and antifungal responsibly. Food safety, be aware of the changes in your health. Practicing healthy habit around your pets and animals, and most importantly, getting vaccinated. Number 2. Improve antibiotic and antifungal use. Working and communicating with a veterinarian. Using antibiotics and antifungals exactly as prescribed. Keeping animals healthy. Number 3. Stop the spread of resistance. Improve the use of antibiotics and antifungals, identifying potential resistance threats, organizing regional responses, and stopping the spread of infection. Access enhanced data tools to learn about resistant germs and affected people. Promote lab epidemiology coordination, which is essential to stop the spread of new threats. Track antibiotic and antifungal use in settings like nursing homes and long-term care facilities, which often does not exist or is difficult. Lastly, improve antibiotic and antifungal use with tailored interventions.